Good morning, everyone. Respected Chief Guest and Conference Chairperson Dr. Mahipal S. Sasdeva for gracing this occasion and supporting this event, sir. We are very much thankful to you and especially thankful to all the delegates who have come on this Sunday morning because for we all as a busy schedule and Sunday is a day for relaxing, but we have spent your time for this academic event, and I am thankful to all of you and the organizing committee for organizing this program. So now, sir, I'll just tell you what our association is. This is Association of Environmental and Occupational Health Delhi, and we are the Association of Industrial Doctors from Public Sector Undertakings, Indian Railways, ESIC, government organizations, and other corporates, where industrial physicians, they unitedly work with an aim to study the occupational health issues of industrial workers, its prevention and management. So our association is affiliated with International Commission on Occupational Health, which has a close working relationship with International Labour Organization and the World Health Organization. We have a glorious history of our past presidents. Our past presidents were Dr. Shikha Sharma. She is presently Managing Director of Nutri Health Services. And Dr. V.K. Ramteke, he was DG Health Railways. Dr. P.S. Prasad, he was also DG Health Railways. And Dr. Manu Saxena, he was former Medical Superintendent of BHEL Haridwar. Then Dr. Mrs. Chanda Tripathi is our current president. She is Chief General Manager Medical Services from Corporate Office GAIL India Limited. So our association is supported mainly by the public sector undertakings and the government organizations and our all well-wishers and corporate partners. And we do a lot of academic activities, sir. We have instituted in the honor of the supporting organizations like GAIL Oration, NTPC Oration, Indian Oil Oration, ONGC Oration, Delhi Branch Oration. So there are mainly 5 orations to our credit, and there are 2 fellowship awards which are given every year during our annual conference, and that will be in last of November. And from this year, we will be instituting the Excellence Award for the best workplaces that will be given to the 2 organizations, one in private sector and one in the government sector. And so we have also received the Best Branch Award twice, once in 2015 and the second was in 2018. And we had the highest membership drive for IUH, and this trophy was given to us in 2018 and 19. The Best Resource Person Trophy Award was given twice to Delhi Branch, 2017 and 2018. Then I had the privilege of being the honorary Joint Secretary for IUH in 2017-19, and various orations has been awarded in the Central IUH, which has got 3,000 members across India and across industries, and CKR oration was awarded last time to Dr. Rajiv Kumar Jain. And whenever we get time, we celebrate our achievements. And we are also participating in International Commission on Occupational Health Conclave, which is held every 4 years. And this last year it was in Dublin, Ireland, and many of us, we have participated and presented in this conference. And so we had organized a lot of events, and these are certain glimpses of various events which we have organized. In 2017, IUS Central Conference was organized by us with more than 1,000 participants in that, and that was also held in Steen Auditorium of this India Habitat Center, and it was inaugurated by our Honorary Labour Minister, and other programs were organized by like FSSAI CEO Dr. Pawan Agrawal, Labour Secretary, now Dr. Soumya Swaminathan, she is Chief Scientist in WHO. She was at that time ICMR Chief. And Sister Shivani, she gave the first Delhi branch oration during our conference. So we organize for our academic interest for our doctors, we organize these programs. Like Vision at Work is the first conclave which we'll be having. And other programs we have, this calendar will be shared with you, and it is there on our website also. This is our monthly magazine. Once you become a member, you will receive every month on the sharp dot on 30th or 31st. Our editorial team will send it to you on your emails and on your. This is a very good academic activity which we are sustaining for last 1.5 years. So we have got 3 websites, iusdelhi.com, occucon.com and occuclave.com. On this you can have the glimpses of all our activities and what we are doing in Association of Environment and Occupation Delhi. We are also active on Facebook, Twitter and the LinkedIn pages, and a lot of members are there who are now also live streaming is there for this conference also. So our association enables us to be a good industrial physician, get the right training, have good teachers and role models, believe in and be passionate about your work, deliver quality work on time, network and be culturally sensitive, think of the future generation and mentor them, and have fun and healthy workplaces. And we are thankful to Dr. Sachdeva for initiating this conference, and which is the first conclave which is being organized today. So our role as industrial physician is from preventing the cause to managing the effect. We prevent the health hazards with which our employees are exposed. We even work up to the rehabilitation of those injured employees. So our role as industrial physician is multifocal, sir, from prevention to handling emergencies and emergency medical services to treatment and curative functions in occupational medicine. So this is our future perspective, sir, which will be shown in this short video. This was the launch video during our Occupon.
Any country's economy is dependent upon its industries, and industries are dependent upon its workforce. A healthy workforce is therefore the need of the hour. To discuss this in detail here, we welcome you to the biggest gathering of occupational health specialists in this part of the world. It supports Indian Association of Occupational Health mission to enable occupational health professionals to make India's workplaces healthy, safe and green environment, free from the ill effects of hazards by evolving effective solutions to be the nodal non-governmental organization committed to attain the highest standards of health in India by enabling stakeholders, influencing policy makers, and creating community consciousness. India contributes 17% of global population and is the 3rd largest economy in the world. The contribution of India is set to increase. Occupational health in India is relevant to the future of occupational health in the entire world. Indian Association of Occupational Health mission promises to be an impactful and memorable extravaganza of one of the biggest professional conferences and exhibitions held in this part of the world. New Delhi, India.
So thank you all very much for sparing your time for this lovely conference. So that will be a great academic feast today. So thank you all.